Dr. Mukti, Associate Consultant at Cloudnine Sector 14. We'll have one-to-one conversation with Dr. Chetna Jain, who is a Director and Senior Consultant Obstetrics and Gynecology at Cloudnine Hospital Sector 14 and also a Director Owner at Dr. Chetna's Clinic in Palam Vihar. Today, we will bust some myths about PCOS. So ma'am, we would like to know, can PCOS stop periods?
Well, PCOS means the woman is not ovulating regularly, so she is likely to have irregular periods. Though majority of the women with PCOS will bleed on their own, some of them have very regular cycles. There would be an advanced spectrum disease wherein there will be no periods at all for 6 months to 1 year or sometimes more. So not all PCOS will not bleed. However, there's a small percentage which will not bleed regularly and they might have longer cycles like 3 months, 4 months, 6 months or 1 year.
Thank you, ma'am. The next one says, is PCOS sexually transmitted?
That's a very funny question. No, PCOS cannot be sexually transmitted. PCO is a hormonal disorder and it can never be sexually transmitted. This is because of the inherent genetic disease in the body, and also it gets precipitated because of the poor physical activity and the eating habits.
We would like to know, can one conceive naturally in PCOS?
Yeah, certainly. Majority of the women with PCOS, I would say at least half, would conceive on their own, and the other 50% will actually need some kind of treatment. A majority will need very little treatment, so do not get worried. A lot of girls come these days and they are too hyped about the whole thing that I have PCOS and what is my fertility. Mind it, there's a very interesting fact here that women with PCOS are likely to remain fertile for a longer number of years compared to those who are not PCO.
Right. So, and what is the difference between PCOD and PCOS?
Well, this is the same spectrum, only thing is the severity of the disease. So PCOD means you have all the hormonal disturbances of high levels of estrogen and androgens and low levels of progesterone, and wherein the eggs are not released. On ultrasound, you get a necklace pattern on the ovaries. In PCOS, the syndrome thing, you have all the symptoms, like you have facial hair, you have black discoloration of skin in the neck, in the underarms, you tend to gain weight very fast, the cycles are anovulatory, there could be difficulty in conception, and the weight gain is typically disproportionate to what you eat. There could be prolonged periods of no period at all. So this could be polycystic. So basically the disease is the same. It is the severity of spectrum that differentiates the two.
And we would like to know, what are the symptoms when one person knows is a PCOS?
Right. So how do you know that you have PCOS?
That's right.
So if you start gaining weight suddenly and you notice male type of hair on your chin or on the side of the cheeks, your periods are not coming regular, or you get only brown discharge, you are gaining weight suddenly, you realize that your forehead or nape of the neck, that is behind the neck, or underarms or bikini area is turning quite black and is much more darker than what it should be based on your skin color, and some women can actually present with abnormal blood sugars. So if you have these, you must consult a gynecologist to know whether you have PCOS.
Thank you, ma'am.
Thank you. It was nice.